A lot of the stuff that was in my two chapters are actually things that have been covered by people already. Chapter 18 was about continuance of the ACA with improvements, but it started by talking about problems with the ACA, which you all already talked about. Millions are still uninsured because even with the subsidies they can't afford care. It was interesting, it said that 80% of the people who are still uninsured have less than $1,000 in savings. And obviously these are people who don't qualify for the government programs. 20 states opted out of the Medicaid expansion. That's almost half the country. And everybody talked a lot about how much cost shifting has gone to patients and how that has resulted in a lot of people not seeking the care that they need. I'm one of those people. My insurance got way worse under the ACA, and I have a huge deductible, so I basically never go to the doctor. I did get some good medical care in Mexico recently, though. And everyone else has already talked about the inadequate price controls. Basically, there are none, so we're faced with skyrocketing costs. So, and the public option was excluded. The co-ops were introduced sort of to replace the public option, but they didn't work and most of them have folded. So the question is, can the Affordable Care Act be improved? Hillary's ideas are to cap the patient's share of the costs. I don't know exactly how she would do that, but that would be a good starting place, because that's basically what has happened, is a huge shift of costs to the patients. One of the things that has been proposed is to require every health plan to have some care that's provided before the patient has to start paying. 3 sick visits, but I mean, that's kind of ridiculous and arbitrary. Obviously, people are going to need more than that. Another thing that she has talked about is using antitrust law to oppose the mergers that are causing this tremendous consolidation that other people talked about today, which is basically shifting the balance of power away from consumers. Another possibility is to bring back the public option. But one problem with doing that is that the insurance companies would probably continue to cherry pick, and the people who would go into the public option would be the sicker, more expensive patients. And they didn't talk about this in the book, but I will just add that a public option that's not in a single payer system doesn't allow all that market power that you have in a single payer system to lower costs. So that's what the book said about how the ACA can be approved. And then it just went on to talk some more about what a failure the ACA has been in terms of the things that have already been mentioned. Millions of people uninsured, skyrocketing costs. There's a really good table on page 178 that shows the salaries of the CEOs of 5 or 6 major healthcare companies, and it should be rated X because it's really obscene. I mean, the amount of money those guys are raking in is just obscene. And also state and federal budgets are being heavily strained by out-of-control costs, because a lot of the subsidies are being picked up by the government, but they're not using their power as government agents to lower costs. They're just shelling out huge amounts of money. So it's basically a huge taxpayer subsidy to the private insurance companies. So that was chapter 18. Chapter 19 was called the Republican Plan, which is kind of a misnomer because there is no plan. The Republicans all have a variation on the theme of reduce government intervention and regulation and let the market work and everything will work itself out. And of course, that's what got us into this mess in the first place. They've talked about removing the individual mandate, removing the employer mandate, removing the medical device tax, repealing the independent payment advisory board, and all just ways of, taking away little pieces of the ACA. And transforming Medicaid to a block grant program or a voucher program, kind of like what they've done with Medicare. The Republican Congress has voted 56 times to repeal the ACA completely, which they haven't been successful in doing. It went specifically into what Jeb Bush and Trump and Marco Rubio proposed. Jeb Bush is no longer in the race. I have a really hard time talking about anything having to do with Trump, but I will tell you, he used to be for single payer, probably some of you heard that. Now he's just basically saying we could allow health plans to be sold across state lines. And the book doesn't really explain why he thinks that's going to improve healthcare. I don't see how it could. And I don't remember what Marco Rubio said. It was, I'm sure, some version of, less government, let the market work. So that was chapter 18 and 19. Okay?
Thank you, Susan.